Hi, Jim Murphy for Elite Style Massage. Today's video is going to be about shoulder injuries, or in particular a shoulder injury that can happen. Now, the most common shoulder injury is a rotator cuff injury. If you train or you do sport, you've probably injured your rotator cuff at some point through your training career and sporting career. It just happens, you know, things go wrong, we get imbalances in the shoulders, things can get impinged. There's another issue that affects the acromioclavicular ligament, so the A.C joint. You might have heard of an A.C joint if you've looked into shoulder injuries. It will make your shoulders look like they're deformed. Like sometimes one shoulder will look lower, or actually you might think one shoulder is higher on one side. And do you ride a push bike, a motorbike, or do you do martial arts? These are common things that people will injure their A.C joint from doing, because if they've gone over their handlebars at any time and landed on the shoulder, push bike, motorbike, doing martial arts, you can get thrown and land on that shoulder. What you do is you damage that ligament. So I'll put a picture up of the A.C joint, where it is and what it is. So it's the front of the clavicle that joins the acromion. There's a ligament. People that don't know anatomy that well, if you look at your ankle and you sprain your ankle, that's what you're injuring, is a ligament. And it's the same thing in the A.C joint, it's a ligament. So ligaments hold your bones together. So you can have an injury where you overstretch the ligament. You could partially tear it, partially rupture it, or you can have a full rupture. Now, normally a full rupture would require surgery. You'd need to go and get medical intervention to help repair that. A partial rupture, or even overstretching it, you can normally rehab it. There's various things you can do with resistance bands and various sort of things you can do just to tighten things up in that area. For the most part, people don't tend to suffer too much with problems with an A.C joint injury. Like spraining your ankle, you might be aware of it and you might feel it, but it gets better over time. If it's bad enough but not ruptured, but quite a serious strain in the area, or sprain in that area, you might have not restrictive movement, but you might just be aware of it when you do certain movements with the shoulder. So it might not be stopping you, but it might kind of limit the way you're pushing yourself. And that is what I tend to find with A.C joint injuries, is people, they leave it for years even, and sometimes don't even ever get anything done about it because they can just muddle through. It's not something that's stopping them. My best friend, actually, he went over his handlebars on his motorbike and landed on that shoulder, and he came to me and we had to look, and he's injured his A.C joint. Now, they've offered him surgery as an option, because I think his is a grade 2 injury. They've offered him surgery if he wants it, or they've said to him that he can manage it. Now, surgery is always a last resort. Is it impacting his life that much? Is it that bad where he's, you know, he's not in agony with it? He's got a little bit of pain at certain movements, but he's not in agony with it. Would it be worth going through surgery and other problems that can create? Surgery can cure a few things, but it can create a few problems as well. So you've got to look at what the pros and cons are going to be for a procedure like that. If you had a full rupture and you was in a lot of pain and didn't have movement at all, and they need to reattach that ligament, fine, yeah, I'd say go for it. But if there's a way you can manage it with some rehab physio, I would certainly look into doing that. People are very quick to go under the knife because they want it fixed. They think it's going to be an instant fix, but there is an element of rehab that has to happen with an injury like that. The same as if you sprain your ankle. People ask me how long these injuries will last. If you go over on your ankle and sprain your ankle quite badly, you're looking at a minimum of 6 to 8 weeks, and usually longer, because as soon as you get up and walk around on it, you're re-injuring it. So it delays the process of it recovering. And an ankle is a tricky one because you've got all your weight on it, same with a knee. A shoulder's a little bit easier to rehab because you've not got all the weight of your body. You've got the weight of your arm pulling down on it. So sometimes they'll put your arm in a sling just to let things settle down a little bit. But if you have gone over and landed on your shoulder, or you know anyone, partner, friend, family member, that's gone over and landed on that shoulder and they've been moaning about, you know, my shoulders hurt, you know, and they haven't got anyone to look at it, just get them to have a look, or have a look at their shoulder. I'll see if I can find a picture of what it looks like when one shoulder is dropped, not just an animated picture. I'll pop it in there now for you. But get them to go and see someone, either a physio or a sports therapist like myself. Get them to get some rehab done on that shoulder, strengthen things up, try and tighten things up through that ligament and around that shoulder area. And it will help their symptoms and their pain greatly, and get them back to sort of a good range of movement with the shoulder if they've had a limited amount of movement. Because there's things that happen to us that we do just muddle through, you know, because we can, you know. You wouldn't leave toothache. If you had toothache, you'd go and get that sorted today or worse, tomorrow you'll be to the dentist. People walk around with tight backs for years or tight necks for years because they can. It's not completely debilitating. So they muddle through because they can. They pop some Nurofen and just carry on. And they'll always be, oh yeah, but they don't get anything done about it, you know? I always liken it to cars. If you're driving your car and it starts making a knocking sound, you go and get someone to look at it. You don't keep driving it, and then when something goes bang, you wonder, oh, why did that happen? Because you haven't addressed the problem. People leave their backs and they leave their necks for years, and it develops into a further problem, you know, or a worse problem that could have been avoided. You know, sometimes you can have a primary, secondary, tertiary. There could be 2 or 3 things linked from the first thing that happened, you know. So if you have gone over and landed on your shoulder, and you've got a deformed shoulder, go and get it checked. You know, you might not need to see a doctor, but you know, go and see a physio or see someone that deals with movement, you know, movement specialist that can really help you get on with getting that shoulder back to normal function. But for the most part, you know, you shouldn't be having too much trouble with it unless you've had a partial tear or a full tear. But if you've had a full tear, you'd probably be in a lot of pain enough to go and get that looked at properly. So again, another little bit of useful information for you guys to help you with your bodies. That's what these videos are all about, just helping you with things to do with your bodies. If you're liking my content, can you please like and subscribe to my channel? And if you know anyone that might benefit from this video, please share this with them. So as usual, Jim Murphy for Elite Style Massage. Thanks for tuning in, and I'll see you next time.